In this video, we will go over 10 warning signs of colon cancer, that is colorectal cancer. It's a type of cancer that affects the colon or rectum. It's one of the most common types of cancer worldwide. It can cause severe harm and death. But did you know that it's one of the most preventable type of cancer? Colon cancer often starts with no symptoms, but when it progresses, it can cause significant issues. The risk of colorectal cancer increases with age. Most cases affect people over 50 years old, though it can also affect people with young age. Now let's explore how it affects your body. Number 1. Abdominal pain and bloating. Stomach bloating, detention, cramps or pain in the abdominal or bowel region can be symptoms of colon or rectal cancer, although they can also be caused by many other conditions. This pain might feel like a constant ache or cramp in your stomach area, and it can vary in intensity from mild to severe. Abdominal pain and cramping appear when the tumor grows and starts to block the narrow way of the intestine. Thus, it leads to blockage of the stool and gas, leading to discomfort and pain. Although abdominal pain and cramping can be caused by various factors other than colon cancer, such as gas, indigestion of constipation, Crohn's disease, or ulcerative colitis. See your doctor if you experience frequent abdominal pain and bloating that does not have an obvious cause. Number 2. Blood in the stool. You may notice obvious blood in the stool or darker colored bowel movements, which may indicate that there is bleeding within the intestinal tract or rectum. Sometimes bleeding may be present but not visible. This is called occult blood and may not be discovered until a blood test indicates a low red blood cell count. Remember, not all colon cancer make you bleed, and just because you don't see blood doesn't mean you don't have colon cancer. So if you see a blood in your stool or on the toilet paper, it is important to talk to your doctor. Number 3. Unexplained weight loss, loss of appetite. Losing weight, losing your appetite, or feeling weak are all possible signs of colon or rectal cancer along with other unrelated conditions. In patients with colon or rectal cancer, these symptoms are usually related. Persistent diarrhea can cause weight loss. Stomach pain and nausea can reduce your appetite so that you don't consume enough food to maintain your weight. All these issues, as well as anemia, can lead to a weakness. However, unexplained weight loss can have various causes besides colon cancer, such as thyroid disorders, diabetes, or depression. Therefore, it is crucial to consult a healthcare professional if you experience unexplained weight loss to determine the underlying cause and receive appropriate treatment. Number 4. Fatigue and weakness. It usually develops as the cancer progresses and affects the body's overall functioning. Additionally, as the cancer grows, it may result in internal bleeding, resulting in anemia, a condition characterized by a low red blood cell count. So when it is in position, it reduces the blood's ability to carry oxygen to tissues and organs, leading to fatigue and weakness. Therefore, it is important to pay attention to persistent fatigue and weakness, especially if they interfere with your daily activities and don't improve with rest. Number 5. Anemia. Anemia is a blood disorder characterized by a deficiency of red blood cell or hemoglobin. In patients with colon or rectal cancer, intestinal bleeding may cause anemia. Depending on the location of the bleeding within the colon, anemia can be the first sign that blood loss is occurring. Common symptoms of anemia include skin pallor, increased heart rate, fatigue, dizziness, and irregular menstruation. These symptoms occur because the body cells and tissues aren't receiving adequate oxygen supply due to the decreased number of red blood cells. Number 6. Nausea and vomiting. Nausea and vomiting can occur if a colon or rectal tumor is obstructing the bowel and inhibiting the passage of liquid or solid waste or gas. Bowel blockage can also be accompanied by painful abdominal cramps, bloating, and constipation. Nausea and vomiting are symptoms of a range of conditions, which may be benign or serious. If you experience persistent nausea, signs of dehydration or vomiting that last for more than 24 hours, you need to seek immediate medical treatment. Number 7. Rectal bleeding. Bright red blood in the stool typically indicates that there is bleeding in the rectum or colon, which may be a sign of colon or rectal cancer. Rectal bleeding can also be caused by hemorrhoids. Typically, patients with hemorrhoids experience symptoms that come and go with flare-ups, whereas rectal bleeding caused by cancer usually continues or worsens and is more likely to be accompanied by pain. However, it is important to note that not all colon cancer causes rectal bleeding, and the absence of bleeding doesn't rule out the possibility of cancer. Persistent rectal bleeding should always be evaluated by a healthcare professional, as it may indicate an underlying health issue. Number 8. Change in bowel habits. Changes in bowel habits that can indicate colon or rectal cancer include new onset constipation or diarrhea, changes in frequency or size and caliber of bowel movement, a bowel that doesn't seem to empty completely, stool that is narrower than normal. Occasional bowel changes can be caused by dietary change, disagreeable food, or a viral and bacterial infection. However, if you are experiencing something new and unexplained and it lasts more than a couple of days, please see your doctor. Number 9. Pencil thin stool. So, have you noticed that your poop is really thin, kind of like pencil? This change where your stool becomes much narrower than usual. It could be a sign that you should pay attention to avoid further spreading of colon cancer to your body. Therefore, when you see this kind of a sign, I suggest you visit your medical professional for further examination. Number 10. Discomfort when sitting. One can feel discomfort and pain when sitting. This comes in mind that colon cancer might have spread to pelvic areas, though it's not common in patients with colon or rectal cancer. But when you see this kind of symptom, please visit a medical center for checkup before it's too late. Now, how do you prevent colon cancer? Screening tests are performed to look for disease when a patient does not possess symptoms. It is the best method for colon cancer prevention and early detection. It can also be reduced by eating healthy diet, staying physically active, not smoking tobacco, and limiting alcohol. Your doctor may ask for a stool sample or suggest a colonoscopy, which is the gold standard for colon cancer screening. A colonoscopy can identify and remove precancerous polyps before they develop into cancer, thereby reducing your cancer risk. It has been shown that pillolectomy reduces colorectal cancer incidence and mortality. This test will need to be done at regular intervals.